Okay, well, thank you for joining Connecticut Voices for Children's webinar discussion on the state of children and families in the greater Hartford area. I'm Mike Sullivan. I'm Communications Director at Connecticut Voices, and presenting today are Orlando Rodriguez, who is a Senior Policy Fellow, and Edie Joseph, who is a Policy Fellow here. Orlando will start by giving an overview of local data, looking at unemployment, income, housing, demographics, what we're seeing in towns in the greater Hartford area. And then Edie will talk about how we can make targeted and smart investment in children and families, looking at where the needs are and what kind of policy recommendations can improve opportunities for families in the region. And just some sort of housekeeping notes. Most of you are probably listening by phone. You should also be able to listen online by following the audio link near the top of your screen. You may need to use headphones or tweak your volume settings a bit for that to work. You can type messages to us in the left part of your screen towards the bottom there. Because there are so many folks on the line, we'll be taking questions via the web chat feature here rather than by phone. So you can sort of ask questions along the way, or we'll be taking a break after Orlando's presentation for some questions, and then after Edie, we'll open it up for questions again as well. We are recording the webinar, so if you want to share it with folks afterwards, you can do that. We'll send you a link probably by tomorrow morning with the sort of video of the presentation and with the presentation itself. And then finally, we'd just like to thank the Fund for Greater Hartford and the Roskin Trust at the Hartford Foundation for Public Giving for their generous support of this event. And with that, I'll hand it over to Orlando Rodriguez to get it started.
Hello, I'd like to welcome everyone. We've got 49 people on, and this is a new win for us. This is our first webinar, so I expect you to expect the unexpected, and we hopefully we'll all get through it. Edie and I have been doing different versions of this presentation across the state to different community foundations. This is the first webinar for Voices, and we're really excited. And as Michael says, if you have questions, please send them in, and we'll get to them as we go along. I'll be doing the first part on income, equity, and demographics, and then Edie will do the second and the third part. The first part's going to be income, equity, and demographics, and Edie will talk about targeted investments and policy recommendations. For those of you who may not be familiar with Voices, we are a nonpartisan nonprofit focusing on research and advocacy. Our mission is to promote the well-being of young families, children across the state, based on public investments and wise policies. In particular, we focus on high-quality research and analysis. We're data-driven. We develop specific policies. We communicate with stakeholders through vehicles like this webinar. And we like to think of ourselves as the main voice for children in Connecticut. So thank you for being with us. This webinar focuses on 31 towns that are part of the Fund for Greater Hartford in northern central Connecticut. What you see there are the list of the towns if you want to print them out so you know what we're talking about as we go along. We haven't labeled all the towns because there's not enough space. It would be too busy for the slides. Okay, first part. Income in Connecticut. As you know, there's a great disparity in income in Connecticut. What we're looking at here is 2011 median household income. And the extremes that you see throughout Connecticut, you also see within these 31 towns. The lowest median household income is in Hartford at approximately $29,000, and the highest is in Simsbury at approximately $116,000, $117,000 per year. Hartford has the lowest income in the state by far when you look at median household income. If you look at other measures like per capita income, it might be a little different. The per capita income can be skewed if you have dorms or prisons. So we like to use median household income as a more reliable measure. Unemployment. In 2012, statewide unemployment was 8.4%. As you can see, we had some pockets of high unemployment in this area. In particular, Hartford had the highest unemployment in the state. East Hartford was also high. Bloomfield, New Britain, Windsor Locks, and East Windsor were also above the state average. But by and large, if you look at the 31 towns in this region, most of them were below the statewide unemployment rate. But if you look at the towns with the largest concentrations of people, they had the highest unemployment rates. I want to talk about the poverty measure a little bit. If you look at the official poverty measure, which is what is used throughout this presentation, nationwide in 2012, the poverty rate was about 15%. And in Connecticut, it was about 9.8, 10%, which made Connecticut rank not 49th out of 50. There was only one other state that had less poverty than us, and that was New Hampshire. However, there have been some concerns with this poverty measure. For some have said rightly that it doesn't take into account the value of in-kind benefits such as SNAP, TANF, housing programs, energy assistance. It doesn't take into account the cost of living across the country. So some have said, well, you know, it could be better here, it could be worse here. We really don't know because the poverty measure doesn't really allow for much flexibility. It's the same threshold across the country, regardless of if you live in Ohio or if you live in Stamford, Connecticut, the poverty threshold is the same. And in 2012, for a family of 4 with 2 children, it was $23,283 throughout the country, regardless of where you live. So there's a new poverty measure that's come about. It's called the supplemental poverty measure, and it does take into account in-kind benefits, SNAP, TANF, work expenses, housing, just about everything. It does take into account differences in cost of living across the country. So the threshold will be different in Iowa than it will be in Connecticut. The thresholds are even different within different parts of Connecticut. So in 2012, for example, the threshold for a family of 4 with 2 children in rental housing was $26,000 in the Hartford metro area, compared to $23,000 nationwide. So you can see that poverty here, if we were to use the supplemental poverty measure, which is a more accurate measure, is even higher than we expect it to be. And in particular, if you use this new supplemental poverty measure, you'll see that Connecticut, the poverty rate is not 9.8, but 12.5, and that we're not 49th, but we're actually 33rd. So a more realistic measure of poverty shows that the poverty in Connecticut is really quite a bit more prevalent than the measures have historically shown. Now, throughout the rest of the presentation, we're going to be using the older poverty measure because that's the only data that's available. Children living in poverty. Statewide rate was about 12-13%. We had some very high concentrations of children living in poverty. Hartford had 44% of children living in poverty and had the highest rate of child poverty in the state. Also, a quarter of all children in East Hartford, a third of all children in New Britain. We also see above statewide rates in Middletown, Manchester, and Vernon. In terms of increase in child poverty, in 2007, 11% of all children statewide lived in poverty. That's using the national lower threshold. And in 2012, it was 13%. We've seen a 30% increase in child poverty, or 27,000 more children living in poverty in 2012 than in 2007. Now, a quick review of demographics. We've got 31 towns, and we don't expect you to memorize these. We have our trouble memorizing too, so we've just highlighted the extremes of highs and lows. And within this region of 31 towns, you've got very small population towns like Andover, And then you have high population town of Hartford. And what we're counting in here is the household population. So this excludes people who are dorm students or in prisons. It really gives you a better measure of the population and their social economics. The median age also varies dramatically. The highest is in Bloomfield, almost 48. Median age of almost 48. Bloomfield has one of the oldest populations in the state. And then Hartford at about 30 years. Hartford has one of the youngest populations across the state. Age 0 to 17, Hartford, again, has the largest population in this age group, and it's not a coincidence that it also has the lowest median age. What's a new interesting trend that we're seeing is a change in the population 0 to 17. It's declining, and projections have forecast this since 2008 that the 0 to 17 population would start declining. The K-12 population peaked in around 2004, 2005, and will continue to decline probably to around 2020. And then we'll come up a little bit, but yeah, more than likely, you can't say never, but more than likely, Connecticut's K-12 population has maxed out, and we will more than likely not see those highs of 2004, 2005 again. But there is quite a disparity within this group and within the state. You might see that Hartford, for example, has lost about 4,400 children. But you go to Avon and you've gained 639. And that's a trend we're seeing nationally and statewide, where upper income households are having children, but middle income and lower income households are not. There was a very important report done on Pew by this, and a lot of it is driven by economics. Middle income and low income people, high unemployment, they believe they can't afford to have children, and you're seeing that in the 0 to 17 population, the variation across the state. In terms of high school completion, lowest rate was in Simsbury. No coincidence that Simsbury also has the highest income. The highest rate of non-completion of high school was in Hartford, and it also has the lowest income. Non-Hispanic white population is lowest in Hartford. Hartford is predominantly minority. Granby has the largest concentration of non-Hispanics whites. Not very many minorities in Granby, rural Connecticut. Hispanics are about 45% of the population in Hartford, and within these towns, your largest concentration of African Americans are in Bloomfield. We got a little bit, it's a bit of a slice of America that we see here in Connecticut. Rural, urban, suburban, mirrors what's happening across much of the country. With all these demographics, it can be very overwhelming. What should stand out? What should you focus on? And if we had to pick one demographic group, one cohort, we'd say let's look at single-parent families. Single-parent families are increasing in Connecticut. They went from 29% of all single-parent families with children were 29% of all families in 2000, and they're 32% in 2010. Husband-wife families with children are on the decrease. And the reason we're concerned is because single-parent families disproportionately are living in poverty. If we take a look at the map here, in statewide, we see that 28% of single-parent families were living in poverty, but in Hartford it was almost 50%, 29% in Middletown, 41% in New Britain, 35% in East Hartford. So, we're starting to see some patterns here. Urban areas, young, low income, low education, single-parent families, and poverty. They're all linked together. Affordable housing. If we take a look at the population in rental housing, you can see once again that our urban areas have high concentrations of rental housing. In Hartford, it's 3/4 of all households live in rental housing. and that talks a little bit to the some underlying property tax concerns that we have, but we won't get into that very much. But there's also a lot of transiency when you see high rates of renting versus home ownership. What we also look at is, excuse me, on the map on the right is renter households that pay more than 30% of their income to rent. It's well established that if you're paying over 30%, more than 30% of your income to rent, you're paying too much for your rent. And what's really interesting here is that you see the statewide rate is 75%. 75% of all rental households that make less than $50,000 are paying at least 30% of their income to rent. And you would expect to see a high concentration in our urban areas, in Hartford, East Hartford, New Britain, but you don't. And the reason is because the state's housing policies have focused affordable housing in our urban centers. The consequence of that is that outside our urban centers, you see a higher percentage of households paying more than 30% on their rent. So while looking to the future, we would think affordable housing needs to go into our urban centers, we need to have a broader understanding and see that we may need to move affordable housing out into suburbs and rural areas. Population transiency. What we're looking at here is the percent of the population that has moved within the past year. Statewide is 12%. 12% of the population moves every year. They may move across the street, they may move across the state, they may move across the country. They're just in a different address 12 months from where they are now. Hartford in this region had the highest rate, 23%. Almost a quarter of its population turns over every year. Theoretically, if we could have over 4 years, we could theoretically replace the entire population of Hartford. That's not the way it works, but it gives you a high idea of just how much mobility there is in Hartford. And it's similar in other urban areas through the state. And this has implications for many of our social programs when you have people that are constantly on the move. And looking forward, we're hoping to do a little work looking into child mobility and seeing if it's impacting educational outcomes. We also want to talk a little bit about residential segregation. For the past year or so, I've been involved on a project with the Connecticut Fair Housing Center. It's funded by HUD. It's called the Analysis of Impediments to Fair Housing Choice. And it's basically looking at the status of fair housing in Connecticut. And what the study has found is that when it comes to affordable housing, residential housing in Connecticut, the state is highly residentially segregated by race. If we break the state up into labor market areas, which are defined by the Department of Labor as areas where people are more likely to live and work. If you live in the Hartford labor market area, you're more likely to work there. If you work in the Hartford labor market area, you're more likely to live there. And we see that majority of the towns within this region are in the Hartford labor market area. With a dissimilarity index, and that's a measure of residential segregation of 0.55. What that means is that in the Hartford LMA, if you wanted every street in Hartford to represent the racial concentration of the labor market area as a whole, then 55% of non-Hispanic whites would have to move, or 55% of minorities would have to move. And that is considered a very high level of segregation. You also see it in Bridgeport and New Haven. Enfield, actually segregation there is low. Part of the reason is because it's a smaller area. And also there are quite a few African Americans living in that part of the state. But except for those 5 towns in the northern part of this region, the rest of the 31 towns are all in the Hartford LMA and highly segregated areas. Part of this housing study is using a new classification system by HUD called Racially Concentrated Areas of Poverty. And what they do is they classify census tracts based on two criteria. The population has to be over 50% minority, and the poverty rate has to be at least 3 times the regional poverty rate. If we look statewide, there are 85 census tracts statewide that fit into this category. They represent 8% of the statewide population. 10% of all children in Connecticut live in a racially concentrated area of poverty. 30% of all Hispanics, and a quarter of all non-Hispanic blacks. However, if we look at these 31 towns, we see that the concentration is even higher. 11% of the population in these 31 towns live in a RCAP area, 13% of all children, 37% of Hispanics, and 20% of non-Hispanic blacks. So that's a pretty startling statistic that in these few tracts, we have such a high concentration of minorities and poverty. So let's take a look and see if we have had any questions. Nope. So we're going to move on quickly to Edie.
Great. Hi, everyone. Thanks so much for being here with us today. We're really excited to be doing this webinar, and thanks to Orlando for the first part of the presentation. I see that someone asked if it would be possible to get a copy of this PowerPoint, and the answer is yes. We will be sending a copy to all the participants along with some other information and ways that you can get involved with Connecticut Voices for Children. So you just heard Orlando talk a lot about some of these income and equity measures. And so now we're going to spend the second half of the presentation talking about some targeted investments that we can make to reverse increasing child poverty and to help make sure that our children and families in Connecticut are reaching their full potential. So I'm going to talk about 3 issues. Talk a little bit, again, about some targeted investments in income and equity. I'll talk about high-quality learning. And then finally, I'll talk about healthy childhood development. And then finally, we'll move on and talk about some specific policy recommendations that we can all take, especially policies that are currently in this legislative session. So first, I want to talk about the importance of family economic security and family well-being. One of the big targeted investments that we support here at Connecticut Voices for Children is what's called the Earned Income Tax Credit, or the EITC. The EITC is a crucial support for working families and children. It's a refundable tax credit that only goes to people who are working, and it makes work pay. In 2011, the Earned Income Tax Credit benefited about 180,000 households in Connecticut and lifted over 60,000 people, including 35,000 children, above the poverty line. So the map here shows the percent of Connecticut income tax returns that claim the Earned Income Tax Credit. You'll see that in Hartford, it's about 34% of all tax returns received the EITC, and New Britain about 24%. Overall, almost 30% of all EITC returns statewide were filed in these 31 towns. And you look at the chart on your screen, and we broke down the number of EITC returns in several of the towns and the average credit amount that they received. So the average credit amount is about $600. So this might not seem like a lot of money, but for families that are earning approximately $18,000 a year, that $600 is about 4% of their yearly income. So that's a crucial support for working families, and we know that a lot of that money goes to children in those families, and that's why we support the Earned Income Tax Credit. Another crucial investment is in SNAP, or the Supplemental Nutrition Assistance Program, or what we know of as food stamps. SNAP is an essential support for children and families. We know that it's not just about food, but it's also about, having children be able to meet their full potential, about having children be able to go to school prepared to learn. Study after study shows that children who go to school hungry aren't nearly able to focus as well or to be as prepared as possible for the school day. There's a federal farm bill that is seeking to cut SNAP programs, which would mean almost 70,000 Connecticut families would lose some of their food assistance programs. Governor Malloy shifted some funding in the state budget to preserve SNAP, and we applaud that because as you see from this map, almost 50% of all families with children in Hartford are receiving SNAP benefits. It had the highest rate of families with children receiving SNAP in the entire state. We also see about 23% of families in East Hartford, 32% in New Britain. So again, this is a crucial investment in our children, and it's not just about food, it's really about the overall well-being of that child and of that family. So now I want to talk a little bit about a high-quality learning and achievement. This is something that we really focus on a lot here at Connecticut Voices for Children. One indicator that we use to look at learning and achievement is third grade reading. It's important that we don't think solely about test scores, but this indicator gives us an idea, sort of a proxy to look at some achievement measures. We know that third grade reading is important because it's an indicator of future achievement. There was a recent study by the Annie E. Casey Foundation that found that across the nation, students who were not reading at a proficient level by the third grade were 4 times more likely to leave high school without a diploma than students who graduated, than students who were able to read at a proficient level by that third grade. So we see some pretty staggering numbers here in the Hartford area. About 32% of all third graders were reading at or above goal in Hartford. Only about 25% in East Hartford, 26% in New Britain. So that clearly shows we have some real work to do in helping our children achieve academically. And we know that one way to increase achievement is to put additional time and resources and energy into increasing accessibility for high quality early care and education, and increasing that access to education. The measure that we use to look at early care and education is the percent of kindergartners who have pre-kindergarten experience. So this information comes from the State Department of Education, and it's a self-reported form that families fill out for their kindergarteners. So we see that statewide, about 80% of all kindergarteners reported having some kind of pre-kindergarten experience. So 80% is, on the one hand, it's a pretty high number. You know, that means that almost 8 out of 10 kindergarteners had that pre-K experience. But what we know is that it's that 20% that is most important to reach, and that might be hardest to reach. Pre-kindergarten, and not just any pre-kindergarten, but high-quality, developmentally appropriate pre-kindergarten, creates a foundation for success, and it's especially important for at-risk or low-income children. We know that the achievement gap already exists by kindergarten, so if we're going to help Connecticut's most vulnerable children, we need to increase access to high-quality early care and education. Shifting gears a little bit, another education indicator that we think about here at Voices is school discipline. In particular, the number of students who are arrested out of school. We all know that children learn best when they're in school, and arresting students keeps kids from the classroom. It sets back educational progress, and when students are arrested, it doubles their likelihood of dropping out of school. In September of 2013, Connecticut Voices published a report called Arresting Development, Student Arrest in Connecticut, and it looked at arrests of students across the state from 2007 to 2011. And we found that arrests happen across the state for a variety of behaviors. In fact, we found that 11% of all arrests were for non-criminal, uniquely student behaviors, school policy violations, or things like inappropriate use of cell phones, insubordination, or skipping class. And we're really about trying to reduce that unnecessary student arrests. You'll see here that the state rate of student arrests per 1,000 students enrolled was 5.7. And you look at the map of the Hartford area, New Britain really stands out. They have an arrest rate of 15.8 arrests per 1,000 students enrolled. And what's interesting about student arrests is that, one might expect that arrests are highest in, inner city or urban districts, but really arrests happen all across the state in a variety of different districts. And it's really driven by school practices, not by the students themselves or the makeup of the students in the school. So for example, Hartford had a lower than average rate of student arrests, 4.6 compared to 5.7. And Hartford has done really excellent work in bringing schools and police together to reduce that unnecessary use of student arrests. Another important thing to know about student arrests is that they differ dramatically by race and ethnic background. So for example, black students are almost 4 times more likely to be arrested than white students, and Hispanic students are about 3 times more likely to be arrested than white students. So a little bit later in some of the policy recommendations, I'll be talking about legislation on all of these different issues, but this is something, again, that Connecticut Voices for Children has really worked on strongly over the past couple of years. So moving on to talk a little bit about healthy childhood development. In Connecticut, we're very lucky to have an excellent publicly funded health care program, the Husky program, for low-income children and families. In Connecticut, this program covers children under the age of 19 in families with income up to 185% of the poverty level, pregnant women in families, parents or relative caregivers, and youth in foster care up to the age of 26. And you'll see here that our rates of children without health insurance are pretty low. Statewide, only about 3% of all children under 18 have no health insurance. And some of the bigger cities like Hartford and Middletown, about 6%. But again, this really speaks to the success and public education around the Husky program. So one issue that one of our senior fellows, Mary Alice Lee, really looks at a lot is prenatal care. So again, one of the qualifications for receiving Husky is if you're a pregnant woman in a family with an income under 250% of the poverty level. And having that access for prenatal care is crucially important for all women, but especially for women who have maybe pre-existing conditions or who have high-risk pregnancies. And it lets them have that care to make sure that their child will be born into the healthiest conditions. We see across the state of Connecticut there are pretty high rates of women who had late or no prenatal care. About 13% of all births were for women with that. Again, some of the highest numbers in Hartford, 22%, New Britain, 19%, but also in cities and towns across this area, Granby, almost 20%, Suffield, 13%. So this is about making sure that people know that they are eligible to receive this care when they're pregnant and in families earning under 250% of that federal poverty level. Another indicator that we look at is childbirth, and this is an indicator of births to mothers who are covered by Husky or fee-for-service Medicaid. You'll see here that Hartford had the highest rate of births, of publicly funded births, of 77% of all of those births. East Hartford, almost 60%. New Britain, 70%. Bloomfield, 45%. So this, again, speaks to the vital importance of our publicly funded health care. Without this coverage, many of these women and families might not have access to that prenatal care, to those services to make sure that the birth goes well. Finally, we also look at teenage pregnancies, the percent of all births in that area to teenage mothers. So you'll see here that Hartford had the highest rate of teenage births statewide, about 15%. And we bring this up because we know that it's often teenage mothers who might be a part of single-parent families and might need some of that income assistance, might not know that they're eligible to have a publicly funded birth. And so it's just important when we're thinking about it to take that into consideration.
There's also, if you look closer at the data on teenage pregnancies, you'll see that pregnancies have, overall, teenage pregnancies have come down dramatically, except among Hispanic teenagers. They've come down some, but not as much as you see among blacks and African Americans.
Oh, thanks, Orlando. So we also, finally, we're going to look at another indicator, which is children with lead in their blood. And so this is interesting because it's not, again, it points to a broader issue. Often it's children who are living in older houses, and this disproportionately affects children who are living in inner cities, high poverty inner cities, particularly in Hartford. So you'll see here that 223 children in Hartford had a high level of lead in their blood. And this affects, again, it affects academic performance because it limits their impact of, being able to go to school healthy every single day. So again, it's just another health indicator that we're thinking about here. And so finally, I want to switch gears and talk about some policy recommendations for that Voices has as a priority and concrete kind of action steps that we can take to improve the lives of children and families in our communities. So first, the Earned Income Tax Credit. So we promote the full restoration of the state Earned Income Tax Credit to 30% of the federal tax credit by 2015. And so we know that the EITC, again, is a program with bipartisan support that's responsible for pulling more children out of poverty than any other. So this change, this restoration, is needed to restore a temporary reduction due to budget deficits in 2013. Restoring the EITC to the full 30% is crucial for families in the Hartford area. As I mentioned earlier, over 50,000 EITC returns, about 30% of all returns from the state, were filed in these towns. And alongside the policy recommendations in each of these slides, we list some of the Voices publications. So if you're interested in learning more and receiving more data about this, you can look at those and find those publications on our website. In addition to the Earned Income Tax Credit, we hope to promote legislation to create a new Connecticut Child Tax Credit. Instituting a child tax credit would improve tax fairness by taking into account the cost of raising children and boosting the incomes of working families. So I think many people who have children know how much money it costs to raise that child and to provide things for them. So having this tax credit would, again, increase the fairness of that tax code. Finally, in this income and equity category, we also support legislation that improves the state rainy day fund in order to facilitate larger deposits and to raise the savings limit. Implementing a stronger rainy day fund would give Connecticut a much-needed financial cushion, guarding against sudden spending cuts and tax increases during future economic downturns. So moving on to some of the education topics. Voices promotes legislation to expand access to high-quality early childhood programs, including but not limited to preschool, and additionally, promoting legislation to create the Office of Early Childhood. These are Senate Bills 25 and 26. So again, we know that research shows that access to nurturing, language-rich, and responsive early childhood environments creates a foundation for success in school and in life. Our recent Early Care and Education Progress Report found that 30% of all 3- and 4-year-olds who are earning under 75% of the state median income had no subsidized early care and education, meaning that they had to pay the full cost for that education. We also know that the average yearly cost for preschool, a full-day preschool in a licensed child care facility, reaches almost $11,000. So for example, if you have a family of 3 with both a preschooler and a toddler, the total cost of their child care, that family who's earning the state median income, the total cost of their child care, again, if they're using child care in full-day licensed settings, represents almost 30% of their pre-tax income. So that's to say that high-quality early childhood settings are expensive, not only for low-income families, but also for middle-income families. And so the governor's budget has crucial support for high-quality early care and education, and this proposal increases by over 1,000 the number of slots for Connecticut's most vulnerable 3- and 4-year-olds to access high-quality pre-K education. We also support legislation to create the Office of Early Childhood, which currently operates under an executive order of the governor without explicit legislative authority. The office has the potential to create an early childhood system that serves all families in maximally efficient and effective ways. Malloy has made very concerted efforts, again, to increase access to the quality childhood programs, and we strongly support these legislative proposals. We also support legislation that promotes school and police collaboration to de-escalate student conflict in school and to reduce unnecessary involvement of youth in the juvenile justice system. So as I talked about earlier, student arrests are a problem in Connecticut. And even though we've seen the number of arrests decline in recent years, we know that there's still far too many students who are arrested unnecessarily in Connecticut. What this legislation would do is, as Senate Bill 54, is it defines arrest. It makes arrest data available on strategic school profiles, so making it more transparent and accessible for parents and community members. And it also requires what we call a memorandum of agreement between schools and police. And this is simply an agreement where the schools and police come together and talk about what are the most appropriate and effective ways to deal with student behavior, to make sure that students aren't being arrested for things like skipping class or inappropriate cell phone use. And so this is legislation that is the first step in helping to, again, reduce those unnecessary student arrests and to keep children in school where they belong. We also support measures that connect children in state care to high-quality educational opportunities. We know that children in state care often miss out or are pushed out of quality educational experiences by virtue of their foster care or juvenile justice involvement. So it's especially important for youth, again, who are in the care of the state to have high-quality educational opportunities. These are the kids whom the state is acting as a parent, and they have the responsibility to act as a good parent would and ensure that those children are receiving the highest quality education. And so finally, thinking about healthcare, we would promote legislation that would permit children in Husky A and B to remain on Husky for a full 12 months, regardless of changes in income and household composition. This is under what's called a continuous eligibility rule. And it's a rule that's been promoted and approved by the federal government, and currently it's House Bill 5137. We know that continuous eligibility helps reduce gaps in coverage for eligible children and families. Children are at risk of losing their coverage when families renew their coverage or when they experience changes, again, due to changes in their income or household composition. And national data shows that children with continuous coverage are more likely to receive timely care, they're more likely to get their needs met, and they're more likely to fill their prescriptions. And continuous eligibility is especially important for kids with chronic diseases. So currently there's 32 states and that offer the 12 months of coverage, and so we're promoting legislation in Connecticut that would do the same. And so I just want to make a quick correction, which is that in January of 2014, some of the Husky guidelines actually changed and they increased. So it's now actually 201% of the federal poverty level for kids in Husky A. And for kids in Husky B, those subsidies go up to 323% of the federal poverty level. So this just speaks to things are, really happening fast in the healthcare world, in the Husky world. And so we have several senior policy fellows, Sharon Langer and Mary Alice Lee, who are working on Husky eligibility, and we just published our Husky eligibility manual for 2014. I certainly have not memorized everything in that manual, but it's a pretty invaluable guideline for learning about Husky eligibility. And so we'll make sure that that correction is updated on the PowerPoint that we send out. And so that was just a brief overview of some of our policy recommendations. Again, you can look at all of our Voices publications for more information or reach out to all of the policy fellows here at Voices. As Orlando mentioned in the beginning, we have been going around the state over the past couple of months and doing presentations like these. We've done them at 7 community foundations. I see we have a question whether we are doing a study for the Fairfield County area. In fact, we already did a presentation similar to this for the Fairfield County Community Foundation. But if you're interested in seeing any of our presentations or our research for other areas in Connecticut, all across the state, you should just feel free to email myself. My email is on the next slide, and I can send you that presentation and those materials. So thank you again. I'm going to turn it back over to Mike Sullivan. But before that, if there are any other questions, I only see a couple of things in the chat box. But I encourage you, if you have questions, to type them in the box. We have a couple of minutes to address any questions. And again, you should all feel free to email us with any further questions or clarifications. And also, again, to look at the resources on the Voices website. So thank you again for your time. And here's Mike.
And feel free, if you have any questions, continue typing in the box over there. But in the meantime, I just want to remind folks that we are recording the event, and we'll have that online soon, probably by tomorrow morning if you want to share it with anyone else. And we'll send you a link to that along with a copy of the presentation. And we'll also ask you if you can fill out a brief online questionnaire to tell us what you thought went well or the things we might do better next time. And we also wanted to thank the Fund for Greater Hartford and the Roskin Trust at the Hartford Foundation for Public Giving for their support of this event. Unless there are other questions coming in, I'm not sure. I guess not. But again, Orlando and Edie's emails are on the last slide there, and also you can find them on our website if you have any follow-up questions. And we'll be in touch with a copy of this soon. So thanks so much for your participation, and have a good afternoon.
Thank you. Please stand by.